Hello and welcome to our presentation on the Palliative Care Health Services Delivery Framework implementation and the role of palliative care clinical coaches. Let us introduce ourselves. I'm Leela Vigaski.
I'm Debbie Delangelo.
And I'm Catherine McKenna.
We are three registered nurses currently working as palliative care clinical coaches working under Ontario Health and affiliated with the Dorothy Lay Hospice in Toronto. Today's presentation is to help you gain a better understanding of the palliative care clinical coaching role in the community and how we can support your practice as primary care health physicians and nurse practitioners. Ontario's palliative care strategy is for people with chronic progressive illness. We want to emphasize that ultimately, palliative care is chronic disease care. It is an approach that aims to reduce suffering and improve quality of life for patients who are living with chronic progressive illness, also referred to as a serious illness. Palliative care is care at any stage of chronic progressive serious life-limiting illness. It is at any stage and for any age. Palliative care is a provincial priority for Ontario Health. The Health Services Delivery Framework and the Palliative Care Competency Framework were established by the Ontario Palliative Care Network and Ontario Health to improve equitable access for patients and caregivers and ensure that they are able to receive holistic, proactive, timely, and continuous care and the support they need through the entire spectrum of care. Ontario's palliative care strategy is supported by provincial legislation, including the Compassionate Care Act, which was developed in 2020 and led to the development of the Ontario Provincial Framework for Palliative Care. As physicians and nurse practitioners, you already know that palliative approach to care can be initiated at any stage of chronic progressive illness. It is meant to benefit patients by implementing supports earlier in the illness journey with wraparound services. This way, as the disease progresses, the team evolves with the patient and their family and primary care supports. Earlier identification and initiation of palliative approach applies to advanced or end-stage illness with an estimated survival of less than 1 year. At this stage, your patient may or may not be eligible for Ontario Health at Home services. The end of life stage is a clinical estimated survival of less than 3 to 6 months and includes end of life care. The Health Services Delivery Framework is a model of care approach that aims to reconsider the organization, integration, and delivery of health services for patients and their families as they progress along a care pathway. Its objectives are to optimize health human resources, identify when care can be delivered closer to home. The Health Services Delivery Framework is comprised of 3 models of care. The first is adults receiving care in the community, including adults in long-term care homes. This is the current focus of the Palliative Care Clinical Coaching Initiative across the province. The second is adults receiving care in the hospital, which was just recently released this past September 2025. And the third model of care is children receiving care in all settings, which is tentatively scheduled to be released later this fall. Ontario Health and Ontario Palliative Care Network developed this model of care based on evidence and broad stakeholder involvement, including patients, caregivers, physicians, Indigenous communities, the long-term care sector, and the vulnerably housed population. It is also in alignment with the work that was previously done prior to transitioning to Ontario Health Teams and Health Quality Ontario's palliative care quality standards.
This is the list of the 13 recommendations outlined in the Health Services Delivery Framework. I'm not going to read them all out to you, but I wanted to bring your attention to the prioritized recommendations for implementation. The first 3 recommendations are the foundational elements, and they include early identification of patients who would benefit from palliative care, development of designated care coordinators to support this population, and it's important to note that this does not refer to Ontario Health at Home care coordinators, but rather a person whose role it is to support the patient throughout their illness. And the third is 24/7 access to an interprofessional palliative care team. And then the system gaps, which are recommendations 6 to 7. And they include emotional, psychological, and spiritual care, and practical and social supports. Some of these recommendations will be more relevant than others to your specific practice, and many may be things that you are already doing. If working with a clinical coach, we will tailor our action plans to best meet your needs. Our program is specifically looking at working with primary care that work with populations including geriatrics, for example, seniors living in the community who may be isolated or have complex needs, individuals experiencing homelessness or vulnerably housed, and newcomers and refugees. If I draw your attention to the diagram on the left, you can see that primary care is the core team. And when we talk about a palliative approach to care, it is important to emphasize care coordination, communication, and collaboration between the core team, extended services, and palliative care specialists. If we take a look at the diagram on the right, you can see the different pathways a patient may take depending on their needs. Palliative specialists are great resources for clients with complex situations or difficult to manage symptoms, but a palliative approach to care should be provided by all healthcare providers. We can see in this image that patients might need different levels of palliative care throughout their illness based on their complexity. Often, we have patients like patient A, whose needs are well met by primary level palliative care providers, which is you, their primary care provider. In other cases, you can have patients like patient B, C, or D that sometimes require intervention from a palliative specialist, either via consultation or shared care, but overall are managed by their primary care provider. Finally, on rare occasions, you have patients like patient F, whose needs are more complex and therefore require transfer of care to specialist palliative care services. Ultimately, we all provide a palliative approach to care, but what that may look like might be different for different patients. OMA's prescription for Ontario to enhance palliative care highlights the following recommendations. The first is more support and capacity to allow patients to receive palliative care where they need it, including at home. The next is greater investment in palliative infrastructure based on geographical need. In other words, it shouldn't be a postal code lottery. Next is an increased number of skilled palliative care providers, including physicians, nurse practitioners, nurses, and allied providers, by increasing opportunities for training. And finally, making palliative care accessible 24/7, including virtually, in all regions and for diverse populations. The following slides will highlight how we as palliative care clinical coaches can help address some of these gaps.
The care you are already providing to your patients is outstanding. As palliative care clinical coaches, we are here to ease the load by gathering resources and tools that let you spend more time where you want to be with your patients and families. One of the main things we're hearing from primary care practitioners, such as yourselves, is that you don't have time to research who the community providers are, the services they provide, and how to refer to them. Additionally, we have been told by primary care that they are in need of a care coordinator or a navigator in the community, similar to the scope navigators in the hospital, who can help facilitate seamless transitions and care for your patients. In an ideal world, we would want every primary care practice to have a designated navigator, but we understand that this is not a reality at this time. Here are a few examples of how the palliative care clinical coaches can support some of these challenges that you may be experiencing within your practice. Firstly, we can coordinate connections. You can leverage your palliative care clinical coach for time-consuming tasks such as collating regional resources, identifying who the community providers are, their services, and how to refer to them. Funded education. To enhance your palliative care foundational knowledge, we can provide access to funded education for yourself and staff, such as LEAP Palliative Care, Canadian Serious Illness Conversation Training, and Advanced Learning in Palliative Medicine online courses. Some of these courses have Main Pro Plus credits and Mach 3 Sec 3 credits as well. Under resources, you already are practicing a palliative approach to care, but are you optimizing billing opportunities? For example, we have created a resource on palliative billing codes that we can provide for you to ensure that you're recognized for all of the time and effort you put into caring for your patients with palliative needs. We would be happy to work with you and your healthcare team to create additional resources that can be catered to your specific practice needs. EMR. Let's identify EMR system triggers and upgrades for earlier identification and advanced care planning for your patients as applicable. This may include incorporation of validated earlier identification tools as well. Patient pathways. Physicians and nurse practitioners have asked for patient pathways. We can populate the model of care patient pathway that already exists in the adults receiving palliative care in the community settings document to be customized to your community and patient needs. Navigating palliative supports. Let's acknowledge that navigating palliative supports can often be difficult, frustrating, and time-consuming. We can support in formalizing processes for one-off consults, shared care with palliative specialists through phone or e-consults early in the patient's illness trajectory. For example, are you signed up with Scope? Are you signed up with the OTN Hub as well? These are just a few examples of how a palliative care clinical coach can support you in your practice. So to summarize, the role of the palliative care clinical coach is that we are palliative care specialists that work with primary care and community organizations to build primary level palliative care competencies, improve your approach to palliative care, and strengthen system connections. Our goals is to embed sustainable change into your practice. The palliative care clinical coaching process. While we are not looking to reinvent the wheel, and to reiterate, we are certainly not looking to add to your already extremely busy patient caseloads, we acknowledge that you are already stretched thin in your busy practices. As well, we are not trying to undertake complicated QI projects, but rather complete small, low-intensity, efficient, and high-impact initiatives that will help streamline your processes. The clinical coaching initiative is rooted in quality improvement, and this diagram outlines the clinical coaching process. It starts off with the needs assessment, which we refer to as the COAT. This is an Ontario Health created tool and is completed collaboratively with the palliative care clinical coaches and your practice. Including your interdisciplinary team, you get to decide who needs to be at this meeting. This will usually require approximately 1 hour initial meeting to complete together, in person or virtually, whatever your preference. After the code is completed, the clinical coaches will review the findings and develop a custom action plan based on the needs identified. During this process, we want to help support any quick requirements and positively impact the patient care experience. We will usually request to have a short post-coast meeting, usually 1 to 2 weeks later, to review our findings and propose an action plan for you to review and to approve. Along with this, education and coaching, we have access to funding dollars for formal education from palliative care experts to support you and your staff. And during the implementation process, we will collaborate together to implement the customized plan project that we have created together. Evaluation, in order to evaluate whether or not change is successful, we need to continually evaluate change and adapt as needed. Therefore, we will recollect COAT data in 6 months to assess the progress. We acknowledge the demands you are facing as primary care providers. Our team hopes you are open to leveraging the palliative care clinical coaching role to support meeting your needs as you care for your patients with chronic progressive disease. Do not hesitate to reach out to us with any additional questions. We are looking forward to hearing from you to schedule your initial meeting. And please feel free to use the QR code up here in the right corner today to access us more easily. Thank you for your time today.